Hi everybody, and welcome to another segment of MedTalk by Doctores Especialistas, brought to you by Medical Tourism. Right now I have as a guest Dr. Martín Bravo. And don't forget to check the full interview in Spanish. We're going to leave some subtitles for you guys, where we talked about regenerative medicine. Dr. Martín has his practice all the way in Chihuahua. He's a general surgeon with 30 years of experience. This segment is dedicated for international patients who are interested in getting more information on getting this regenerative. How do you call them in English? Regenerative treatments, or what's the right word?
They call it regen medicine or regenerative medicine. It's the same.
Okay. Thank you very much for your time, doctor. And for our international audience, if I am outside of Mexico, can I start the process online?
Yes, you can. It's important to make an assessment, a clinical assessment on the problem you have, how long has the problem been there on your body, and to have at least a biochemical analysis on how are you performing metabolically. So yeah, that would be desired. Now, on the other hand, it is always more desirable to see the patient directly, be present, assessing the disease directly in order to set up treatment correctly.
Okay, so if I need to travel to Chihuahua in this case to get the treatment, how much time do I have to be there? How long do I have to plan my trip for?
Usually it takes 2 days. Why 2 days? We would like to do the right assessment to explain correctly the type of treatment, the procedure, and all the treatment logistics that involve regenerative medicine. And information is crucial in this step because patient has questions and is the first front phase of regen medicine for many of the patients. So we have to explain everything by the points and by the dots. So once the patient is correctly assessed in the type of procedures according to their problem, then we set up the treatment. We are ready to provide the treatment in the same day. We do the infusion of the stem cells through the bloodstream. That usually takes around 1 hour, 1 hour and a half, depending on the problem, and he needs to rest. That's important. And next day we do a secondary assessment to see how the procedure went, how is he feeling, and the rest of the variables. Usually the patient responds well to this type of treatment the first day. So the second day is just to make sure he's all right and he lives back home correctly.
And if I need several treatments, do I have to schedule frequent visits? How much time between visits so I can plan my whole schedule?
Depending on the disease, usually it's around 2 to 3 months. We do follow up via video calls, so it's easier for us to assess if the patient has to come back or something. But in general, it's every 2 to 3 months. If he doesn't have to be there all the time, we just do adjustments. And if he has to come back, then we will explain to him easier what type of treatment or follow-up we'll do on him when he comes back to the clinic. So it's rather easy and it's very advisable because sometimes we have to do adjustments. So the patient feels well, he wants to feel much better, so it's easier.
There you have it, folks. If you are planning on getting these treatments or this type of technology, schedule approximately every 3 months, depending on the disease. So take that into account. We're going to leave the information of the clinic so you can get in touch with the doctor if you have any more questions. And don't forget to check the full interview in Spanish with subtitles. And thank you for listening. Thank you for your time, doctor.
It's a pleasure.